I'm Colin O'Keefe, and this is LXBN TV. Just how affordable is the Affordable Care Act, and how else will we measure the success of this key piece of legislation? Joining me now to speak to both of those questions is a very special guest in Dennis Smith, Medicaid Director under President George W. Bush and Health Services Secretary in the state of Wisconsin. He is now Managing Director at McKenna, and Aldridge, and author on their Politics, Law, and Policy blog. Dennis, first, as it's in the title of the legislation, the key goal of the Affordable Care Act is to make health care and health insurance more affordable. You wrote an excellent piece on this very subject. What are your thoughts here? Will it make health insurance and health care more affordable?
Well, Colin, I think the issue is when people go to the exchange, they're going to ask, what does this mean for me? And for certain individuals who have a lot of health care costs, who are older, their premiums probably are going to be a better deal for them than what they're seeing today in the individual market, because Congress imposed on the market new rating bands. So they have artificially brought down the cost of premiums. Now, somebody else is going to pay for those. So it depends on who you are, on whether or not you're really going to find it more affordable. The other issue is on your own income level. And I think what we're really seeing from the experience in the employer market now, and if you're making the average wages, whether or not you're going to receive a subsidy and how much that subsidy is going to be is whether or not it's going to be affordable for you. I think that when you're getting around the average wage earner is going to be paying the greatest portion of that premium, they're going to really be thinking twice of whether or not this is such a good deal for them. The other thing, remember that the plans themselves are pegged to paying a percentage of the total cost. So the subsidies that the federal government is giving out on the tax credits based on the silver plan, the individual is still going to be paying 30% of those costs through deductibles or co-insurance. So I think for many Americans, there's still going to be a sticker shock.
I see. So second, by what other measures will the Affordable Care Act be evaluated? You wrote on enrollment being a key issue. What are you seeing there?
Well, again, on enrollment, and clearly the act itself was to increase insurance coverage, which happens on its own naturally. Again, we think about the young people who don't buy insurance. Well, they're not buying insurance at that point in time. But when you look at their period of insurance over a 4-year period of time, for example, the percentage of uninsured gets cut in half because now they've entered the workforce. Now they're going through other stages in life, getting married, having children. They are going to get insurance. So what the federal government is really trying to do is speed up that decision-making for that young person. Enrollment itself is going to be measured in many different ways. And as I have said, there are fewer Americans with health insurance today than when the Obama administration began its tenure. So they have to make up ground that has been lost because of the weak economy, because of employees themselves. And it goes back to the affordability. The employee share of premiums has doubled since 1999 on average. So as that cost has gone up, they've cut back on insurance. Then you're going to have 35 to 40% of people who simply are substituting coverage. So you can't really count that as a net gain either. So it's going to be a challenge.
Mm-hmm. Absolutely. It's going to be a fascinating area to watch. Healthcare and health insurance costs are one of the biggest issues in the country right now, so we'll have to see if this legislation is as effective as many people hope it will be. Once again, that was Dennis Smith of McKenna, and Aldridge. For more of his analysis on the Affordable Care Act and the affordability of it, be sure to visit politicsandlawblog.com, where he has some excellent commentary on the Affordable Care Act. And of course, if you're not already watching us here here on the site at LXBN. Visit LXBN.com, where we have hundreds more LXBN TV, video interviews, and curated commentary from the LexBlog Network's more than 8,000 members. Thank you for joining me today, Dennis.
Thank you, Colin.